Hello, everybody. My name is Paula Nebbs, and I'm the lead for the Center for Living Organ Donation. Thank you for joining us today for this webinar on kidney paired donation. And I know that you have a lot of questions and you're anxious to get started. So I would like to welcome our three speakers who will share their knowledge and expertise with you today and also answer your questions. As we go through the presentations, please submit your questions by visiting slido.com and event code KPD. So visit slido.com and event code KPD. As mentioned, we have three speakers, and I'd like to introduce them now. We have Michael Garrels, who's a Kidney Recipient Coordinator for listed patients, including patients in the National Paired Kidney Exchange Program. And Michael is with UHN. He's a registered nurse, and he'll be taking you through the process from a center perspective. We also have with us Sarah Profaniak, who is has a master's in nursing, previously worked with St. Joe's Hamilton, and joined CBS this past February, and is the program manager for the Kidney Paired Donation Program. And finally, we have Goodall-George, who is a member of our center's patient advisory committee, and he's also a donor, a past kidney donor, who currently resides in Manitoba and donated through the CBS Kidney Paired Exchange Program in 2014. And he'll be sharing his story with you today. So again, please keep your questions coming by submitting them to Slido, event code KPD, and I'll turn it over to Sarah to take you through a description of the Kidney Paired Donation Program. Sarah?
Thank you so much, Paula. So I won't waste any time. I just want to thank everyone for joining us. So I'm going to start at the beginning. So the first question you might be asking is, what is the Kidney Paired Donation Program? So the Kidney Paired Donation Program, referred to as KPD, is an interprovincial program operated by Canadian Blood Services in collaboration with Canada's Living Kidney Donation and Kidney Transplant programs. The KPD program gives individuals an opportunity to become a living donor and donate a kidney to someone in need, and in doing so, provide transplant candidates an increased opportunity to receive a transplant. There are 23 programs across Canada currently participating in KPD, including Toronto General Hospital. Before we dive into the KPD program and the chains, I wanted to briefly review what a direct donation is. With direct donation, the donor knows the recipient and wants to donate directly to them. The donor is medically compatible with the recipient and can go ahead and donate a kidney to them. Unfortunately, donors are often incompatible, meaning they are not a match or poorly compatible with their intended recipient. Directed donation in these cases may not be an option or the best option for the recipient. In these situations, pairs may consider the KPD program. So now that everyone has learned what the KPD program is, let's learn how the program matches living donors and recipients across the country. Living donation programs and kidney transplant programs across Canada register the potential living donors and transplant candidates into the Canadian Transplant Registry, which we call CTR. The CTR is a secure computer database managed by Canadian Blood Services, through which sophisticated matching algorithms identify potentially medically suitable matches of transplant candidates with potential donors and non-directed anonymous donors. The matching algorithm compares the medical information of all the pairs and non-directed anonymous donors and identifies chains of potential kidney transplant opportunities. Once potential exchanges and chains are identified, medical teams must determine if it is possible to complete all the matches in the chain before the transplants and donations can proceed. So I briefly mentioned the chains that the CTR creates when we complete a scheduled match run or rerun. Now I will dive a bit into the details of the 3 different kinds of transplant chains that the matching system creates. This image represents a paired exchange. In a paired exchange, donor A wishes to donate a kidney to transplant candidate A, but they are not a match. Donor B would like to donate a kidney to transplant candidate B, but they are not a match. However, donor A is a match with transplant candidate B, and donor B is a match with transplant candidate A. A paired exchange is then complete. Even pairs that are not compatible can enter into a paired exchange if their doctor feels that a better matched donor will lead to better transplant outcomes, or if the pair just wants to help others. A closed chain is similar to a paired exchange, but has 3 or more donor swaps. In a closed chain, the donor of the last pair donates to the recipient of the first pair. In this example, donors are exchanged between 3 pairs, but there is no limit to the number of pairs that can participate in a chain. Approximately 40% of KPD transplants are through paired exchanges and closed chains. Finally, the last chain is called a domino. Domino chains are possible when someone volunteers to donate a kidney anonymously to a stranger. These donors, called non-directed anonymous donors, or NDADs, can initiate a chain that helps multiple patients get a kidney transplant. The NDAD donates to the transplant candidate of a registered pair, with the donor from that pair making a donation to another recipient, and so on. The exchange is complete when the donor of the last registered pair donates to a transplant candidate on a transplant waitlist. So we have reviewed what the KPD program is, how the CTR works, and the 3 different types of chains. Now I'm going to pass it off to Michael, and he is going to explain why you would want to enter the KPD program, what you need to participate, and the importance of anonymity.
Thanks, Sarah. So I just wanted to go through some of the requirements for getting in the system. So basically, every pair needs to go through the usual workup as a recipient and as a potential donor. There's really nothing different about the workups. There's nothing special that we have to do. So, you know, in certain circumstances, every case is different. So you need to be in relatively good health. You must be cleared for transplantation as a recipient. The donors have to be cleared. Testing has to be up to date. And then once that's in place, then we can actually enter you into the system. You have to consent to going into the KPD program because it is run by Canadian Blood Services. So we have to take your health information from your transplant program and put that in. We can also do it with, if you have a donor that is from another province, the local program. So if they're, say, in Vancouver, Vancouver can work up your donor there. They can enter them into the KPD program if they're not a direct donor to you. And we can, so you could be worked up in Toronto as a recipient and have a donor somewhere else in the country. All right. Once you're in that, then as Sarah said, the system looks for potential matches. Once you're matched to a donor and the recipient is, and your donor is matched to somebody else, we have to get, you know, testing completed and confirm that that match is a good match. Depending on how long it takes to find those matches, you may need to do testing updates. So if you're in the program for over a year, both donors and recipients may need annual testing updates, things like that. Also for recipients, if you're on the deceased donor waiting list, you have to have your PRA done every 3 months or every quarter. And you need to continue with that if you're on the paired exchange program as well. All right. A match doesn't always mean that you're going to end up with a transplant. We're having some technical difficulties. It's not advancing. Oh, there we go. It's going backwards. All right, so going back to some of the reasons for entering the KPD program. Most of the time it's because there's an incompatibility between the potential donor and the recipient. So incompatibility could mean that the blood groups are not compatible. So if somebody is a blood group B recipient and they have a blood group A potential donor, that person may not be able to donate to you directly. They would go into this. Or an O recipient with a different blood group would be considered incompatible. The other part is a positive cross match or a donor specific antibody. So if somebody's had previous transplants, for women, if they've been pregnant in the past, if you had blood transfusions, you may have antibodies to other people's tissue typing. And if you have an antibody to your donor, it's like being immunized to that kidney. It can be a very high risk transplant. So we want to avoid antibodies if we can. So in those cases, KPD is usually the best option for getting a standard immune risk living donor transplant. Those are the transplants that are related to the best outcomes. All right. In other cases, a pair may be compatible, but they may have a reason that it would be better to get a different match. So a big size difference between the potential donor and recipient may be a reason you'd go into the paired exchange program, or an age mismatch. So if you had, a relatively young recipient, so say somebody, 25 years old, and their potential donor was, a grandparent, 70 years old, you may want to have, in that case, a different donor give to them. So you're blood type compatible, you're cross-match compatible, but your age or your size is incompatible, and we're trying to get a better match for that recipient. All right. The other reason people go into this program is for if they're a non-directed donor. They're people that just want to help other people, and they can trigger a chain of transplants. And Sarah will talk about how successfully that has impacted the KPD program. One of the things that comes up as you go into this program, in the past, we've usually had donors travel to a transplant center. Right now, we're looking more to have donors that the kidneys ship, but we do have supports for living donors that go into these programs, or for any living donors. So Preload, or the donor reimbursement program here in Ontario, most provinces have a similar program. It helps donors pay for out-of-pocket expenses. So traveling to the hospitals for tests, things like that. So it is not as expensive for donors. All right. Private health plans, so looking at do you have short-term disability, long-term disability, sick benefits, those types of things. There's workplace benefits through the government, such as EI sick leave and things like that. So we do look at all the supports that are available for donors to make this lessen the impact on their financial status. Right. And one of the things that the center is working on is the Living Donor Circle of Excellence. And this is rewarding or recognizing employers that are actively involved in promoting and supporting the act of living donation. One of the key foundations of the KPD program is the anonymity of both recipients and donors within the program. So everybody is anonymous other than the person that you went into the program with. Information about how many people are involved in a potential chain, where those pairs are located. If your kidney is being shipped to a different center, we don't tell you where that center is. We try and keep things as confidential as possible. Now, obviously, if a donor is going from Toronto and flying out to Vancouver to donate, then they'll know where they're going, but they still won't know the recipient that they're giving to. All right. Altruism is one of the key foundations of the KPD program, and without that, we wouldn't have a program. So every donor going in is, while they're not giving directly to the recipient they initially intended, is giving to somebody. And then they also have the altruism of the non-directed anonymous donors who trigger many of the transplants that we do. This is a challenging question for sure. How long will you have to wait to receive a match in the KPD? There are multiple factors here. So one of them is just because you're matched doesn't mean you will get a transplant. So once a match is proposed, we need to do initial cross-matching. There may be 6 or 7 people involved in this whole process. So if one pair is no longer able to proceed, so we find an unexpected cross match, somebody's medical condition changes, that may change that matching. So you may have a proposed match that doesn't go forward, and that may take weeks or months to figure that out. The other thing that can happen is depends on how you're going in and what the dynamics of the pair. So an O recipient with an A donor may wait a significant period of time, whereas somebody that is an A recipient with a B donor going in is likely to get matched relatively quickly, as long as they don't have a lot of things. So as you go in, we will talk to you about your specific circumstances, because all of that impacts how long you'll potentially have to wait. All right.
Okay, so I think it's my turn again. So thank you, Michael. So we just briefly talked about how long you're going to have to wait to receive a match, and Michael discussed a little bit about if something were to happen once you've been proposed. And so I will touch upon that in this section. So now you might be asking yourself, when does the KPD program match pairs? So the KPD program matches pairs in repairs, in reruns, and in match cycles. So the KPD program has 3 scheduled match cycles each year. So one is in February, one is in June, and one is in October. And the next scheduled match cycle will be this coming February in 2021. So when a match cycle is run, the KPD team hits the matching algorithm button, and the CTR identifies all of the possible matches between donors and recipients. And it then tries to fit them into chains of donor exchanges. In between the scheduled match cycles, the KPD team will complete reruns. Reruns allow participants in collapsed chains and participants who did not match during the match cycle the opportunity to match and/or match again if possible. A collapsed chain is a chain that can no longer carry on because one or more of the patients in the chain is no longer able to continue. Finally, a repair may occur at any time during the year. If a chain collapses because a transplant candidate has become ill and/or a donor can no longer proceed, the chain may qualify for repair. It is not always possible to repair a chain, and in those cases, the participants are included in future reruns and the next scheduled match cycle. Now I will briefly discuss about KPD and our response to COVID. KPD launched the KPD COVID Recovery Plan this past June after placing the program on pause in March. The KPD Program Recovery Plan was created by the Kidney Transplant Advisory Committee and the Living Donation Advisory Committee. It focuses on the safety of donors and recipients. Programs and provinces were invited to rejoin KPD once this recovery plan was launched when they were ready. Toronto General is currently participating in KPD. To find out if your program has rejoined, please speak with your transplant center. Just a reminder that as the second wave of the pandemic develops, individual program participation may change. We would like to acknowledge that each program and province will be at different phases of COVID pandemic recovery and the reopening of their living donation programs. So once again, please speak with your transplant program if you have any questions. With the launch of the KPD Recovery Plan, as I have mentioned, donor and recipient safety is the #1 priority. To reduce the donor's risk of exposure to COVID due to travel, KTAC and LDAC, our advisory committees, have recommended that donors do not travel by public transportation, so planes, trains, or buses. And they've recommended that the kidneys are shipped, not the people. So when a kidney is shipped, the donor will have their surgery locally, and their kidney will be shipped to the transplant center. So some advantages of shipping a kidney include no need for the donor to isolate away from home for 2 weeks prior to surgery. It reduces the costs for the donor, and there is no need for the donor to have a support person travel with them, once again saving on the costs. And just something to make note of, the donor may be asked to travel in some circumstances. Not all programs have processes and procedures in place to allow for shipping or receiving an organ. And doctors may decide that it is better for the donor or the recipient to have the donation surgery done at the recipient's transplant center. When a kidney is being shipped, weather, flight availability, flight cancellations, and/or changes, and other factors can impact plans to ship a kidney. Contingency planning is part of every KPD transplant proposal. So now I want to talk a little bit about NDADs, non-directed anonymous donors, which I have referred to and Michael has referred to a few times throughout the slides. As you can see in this domino chain, this chain was started by an NDAD. NDADs are very important to the success of the KPD program. When an NDAD, a person who is not paired with a transplant candidate, yet wishes to donate a kidney to someone in need, enrolls in the KPD program, their kidney donation is not conditional on a friend or family member receiving a transplant in return. This allows the KPD program to identify chains of exchanges that create significant numbers of transplant possibilities that otherwise would not be possible. NDAD donors greatly increase the number of matches that can be made among the registered pairs in the CTR. So the power of the domino is very strong. This generous act of giving by NDADs has meant that as of October 1st of 2020, 469 of the 757 kidney pair donation transplants completed have been through domino exchanges and started by NDADs. To break it down a little more, 145 NDADs have enabled 469 kidney transplants. I am very excited to introduce you to Ian, whose picture you saw on our introductory slide. Ian is from Manitoba and was a non-directed anonymous donor. He donated at Toronto General Hospital through the Kidney Pair Donation Program. In addition to this, he is a member of the Center for Living Organ Donations Volunteer Advisory Committee. And I am now going to pass the microphone off to Ian to share his story.
Hi, everybody. I don't have any fancy slides, so unfortunately, you're just going to have to listen to me talk for a few minutes. My story starts actually at Canadian Blood Services in Winnipeg, their William Avenue location. I was there about, let's say, 9 years ago, maybe 10 years ago. And I was donating platelets, and I finished and I sat down and had that wonderful chocolate donut they give you and that absolutely horrible cup of coffee that you have to drink with I should have had something else, I guess. And I saw a brochure about paired kidney exchange, and I was hooked, basically. I grew up in a home where my parents only had a few rules, and one of the biggest one was that you always gave back, or you always looked for ways to give back. So obviously that was one of the reasons I was there, was donating platelets, but this seemed like an even better or an additional way that I could give back. So I probably wasn't supposed to take the brochure, but I did. I took it, I read it a couple times, folded it, stuck it in my pocket, drove back to work, couldn't stop thinking about this opportunity. So, and then I suddenly realized on my way home that I was going to have to somehow convince my wife that I was about to give away a kidney. So that was probably the hardest part of the entire process, to be completely honest. thought about it for a couple days, drew some diagrams of how I was going to talk to her about it, eventually got up the guts to talk to her about it, and she was very supportive. So went for some testing, which I'm sure all of you will probably get more information about. I won't go into great detail on that. A couple false starts, and about 4 years after that fateful visit to the Canadian Blood Services in Winnipeg, I got on a plane with my wife and flew to Toronto, and about 3 days after that, I got to give away a kidney. So it's funny. People ask me all the time, like, why would you do something like that? And it's actually a very hard question to answer because there's so many different reasons. I mean, I mentioned the fact that my parents instilled in my brother and I the need to give back. So obviously that was one reason. But I think I did it mostly because it was an opportunity to give back. I've been so very blessed, and I have so much to be thankful for in my life. So this was a very small sacrifice that I could do to make a difference in somebody's life. So I'm actually very puzzled when people ask me why I would do it. It just seems like such a simple thing. It's a very basic thing that you can do that makes an incredible difference in somebody's life. And sometimes I say to people, well, imagine that you're in a room full of 500 people, and you know that you have something within yourself in that could save somebody's life in that room. Would you not run and try and find that person and say, hey, listen, let me help you out? So I simplify it because obviously, even if you have the will or the desire to do it, not everybody is eligible. But that's why the folks like Sarah and Michael exist, and the wonderful people at Transplant Manitoba, because it's not hard to make a phone call and find out if you are eligible and go through the testing. And if you are, you can certainly make an amazing difference in somebody's life. So I joke sometimes that I did the donation for a t-shirt, and I'm still waiting for the t-shirt. So I've got a couple more years left before I'm going to give up on the fact that somebody will actually send me a t-shirt. Because honestly, somebody told me early in the process that usually you get a t-shirt for doing this. So I don't know who's going to send it to me, but I'm hoping that somebody will. Another thing that I've been asked to just touch on very briefly is what life has been after making a donation. And it's great. I often say that making a donation has given me a real desire to want to do other things, to want to make a difference. It's given me a zest for life that I didn't have before. I loved to play soccer before I'd made the donation, and I still play soccer. I was terrible before I made the donation. I hoped that making the donation would make me a better soccer player, but it unfortunately didn't. I am still sort of a pylon. So yeah. So I don't want to take up a ton of time. I can talk for hours about the donation journey. So maybe I'll stop here. And if people have questions, I'd be more than happy to talk about it. Thanks.
Thank you, Ian. It's very, very important for us to hear stories like yours, and I can promise that you're going to get a t-shirt. So I know that we have a lot of questions from our audience, and I'm just trying to go on to the next slide, and for some reason having a bit of trouble. But I see here that we have the questions that you've submitted in advance. So a reminder, go to slido.com, code KPD to submit your questions. And so we'll go through these one by one, and if our speakers have additional information that they'd like to share as we go through, we have more than ample time. All right, so first question. What happens if one pair receives a kidney and there's an issue with the second pair and they don't receive a kidney? So maybe Sarah, do you want to talk in general about that? And maybe Michael, maybe you could sort of reflect on an instance when that might have occurred and what the transplant center did in that situation. But I'll turn it over to Sarah first.
Sure. So that is a great question, probably a question that is asked a lot. And so what happens if one pair receives a kidney and there's an issue with the second pair and they don't receive a kidney? So the Kidney Pair Donation Program has a process called the Unpaired Candidate Process. And this process identifies this concern or issue. And then we will work in the background to do everything we can to get the second pair a kidney transplant. So this question, to speak to this question, there's an issue with the second pair. We would need to look at, is there an issue with the recipient or is there an issue with the donor, and then kind of go from there. So depending on where the issue lies, the Kidney Pair Donation Program would address that problem. And then we would do what we would need to do to get that recipient a donor or to help move forward with the transplant. I hope I answered the question. Michael, did I miss anything?
No, I think it's that sums it up. We definitely have processes in place for this. I think it's important to know that while we have processes in place for this, it's an exceedingly rare occurrence for it to actually happen. And often, you know, probably the most common thing that would come up with somebody gets an infection as they, you know, are coming up to their OR time. And in that case, we wouldn't cancel everything. We would just, you know, look at whether or not we would just delay that pair by a time. So it depends a lot on circumstances. It's definitely something that is front and foremost. It's not an afterthought. We have formal process in place, and there's a lot of discussion that goes on around that if something like that does happen.
Mm-hmm. Thank you. And we do know that sometimes delays do happen. It can be very difficult to deal with those delays. But again, policies, processes in place, both nationally and at the individual transplant center levels to address any questions that come up, any issues that come up. Sarah, you, during your presentation, you talked about the matching process. So this next question really gets at that. Perhaps we could review that again. How many factors go into making it match? And at what point do you say, okay, we're done with building the chain?
So there are many factors that go into making a match. So when patients, donors and recipients pairs are put into the CTR, as Michael mentioned, the programs can put in certain age, like age restrictions. They can put in whether or not the donor wants to travel, and those are certain factors that can go into making a match that we can control. Some factors that can go into making a match that we can't control are compatibility. So the CTR will look at the compatibility between the donors and the recipients, and they will look for the best match. At what point do we say, okay, we're done building the chain? We don't say that, the CTR says that. So we will hit the magic matching algorithm button, and it will give us all of the potential chains. And from there, we will take those chains, and there may or may not be ties. So when I say ties, I'm going to take a step back. Patients are given points. And so these points together add up to give a total, and the total number of points, that's the chain that essentially wins, that comes out of the CTR. But chains may have the same number of points. And so we need to look at those and find which combinations are the best. And so once we've decided that, with the help of our HLA committee and our Kidney Transplant Advisory Committee, we will move forward with proposing the best combinations.
And Sarah, I know that sometimes acronyms can be difficult. Remind us again what CTR is. I know at the beginning when I introduced you, I talked about CBS, and I should have said Canadian Blood Services. So what is the CTR?
So it is the Canadian Transplant Registry. So it is an online database, kind of a magic matching matrix system that matches the donors and recipients across the country. So the information that programs put into the CTR, blood type, that you'll put in. Michael, what do you, I'm going to ask you for the details. What does your program put into the CTR?
So CTR is used for both the highly sensitized patient registry through Trillium. So anybody on the deceased donor list, if they're active on the highly sensitized patient registry, they'll be automatically put into CTR. And then we use CTR for the kidney pair donation program. Is that what you're asking?
Yeah, just the information you guys enter when you place a patient into KPD.
Oh, okay. So, you know, obviously basic demographic information, blood type, we put in serology information, height, weight, things like that. And then the really important stuff is the HLA or your cross match. So if somebody has, you know, a couple of antibodies or, you know, lots and lots of antibodies, it's important to have that in, because that's really what helps us make matches.
Fantastic. Thank you very much for that. The next question is more of a policy question. I'm not sure that we necessarily will have an answer to this, but certainly there's a number of ways that various jurisdictions are using to increase awareness and access to living donation, and some jurisdictions use a voucher method for living donations, so to recognize the contribution of those donors and potentially have increased access or access in the future for those donors. Is there, I'll just ask Sarah and Michael whether they're aware of any discussions that are happening with respect to the voucher method for living donation, anything happening at the national level, Sarah?
Yes, this is definitely on our, it's on the dashboard. We are referring to it as advanced donation. And so it's definitely something that we are discussing with our Living Donation Advisory Council and our Kidney Transplant, sorry, I keep saying Council, Advisory Committee, and our Kidney Transplant Advisory Committee. So right now it is something that we are discussing.
Fantastic, thank you. I guess the next question is for Ian. Ian, how did you convince your wife that donating was a good idea? You know, your story raised a very important issue, which is all of this requires support from caregivers, from family, who are also impacted by the decision to donate. Do you want to talk a little bit more about those discussions and subsequent ones that you've had?
Sure. Well, I mean, convincing my wife just involved quite a bit of wine and, you know, things like that. There was, you know, promises of dinners, you know, until the end of time. But no, and in all seriousness, I mean, I think she knew that it was something that I really wanted to do. So we just talked a lot about it. And I think I made sure I had researched the process quite well before I talked to her about it. So, because I knew she'd have some questions. So, but yeah, it's not an easy decision to make. Her first question for me was, well, what if I need a kidney someday, or what if my kids need a kidney someday? And my understanding is that often a familial match isn't the best match. There's often, you know, there's often somebody else out there in the population that's a better match. And I honestly, I think that would be a very selfish thing to do, to not offer to donate a kidney. I mean, there's no history of kidney disease in my family. I don't know anybody that has kidney disease. So it's not like there's somebody within my inner circle that you know, would need my kidney. And maybe if there was, maybe my decision would have been different. Maybe I would have approached that person and been part of a chain in a different way. So, but yeah, it was, and to be in all honesty, I went through all the testing to become a donor, and then my wife got quite sick. So we actually, I withdrew my name from the process, and then about 19 months, almost a year, 2 years went by, and we promised to talk about it once a year. So we did, and I talked to her about it and at a point, and she said she was ready to do it. So that's when I threw my hat in the ring again, and that's when it actually happened. So the timing has to be good. Sometimes you're going to start the process and have to stop and restart again to get to the point where you can make it happen.
Mhm.
Hopefully that answers your question. The wine is a big thing. I think that a lot of you know, a lot of that stuff. You know, I mean, you got to butter people up sometimes if you want something.
I think it's important to note that you know, the family support part of it, as much as Ian's joking about it, is a very important part, and that's something that the donor teams take very seriously. They will explore that in great detail, and if there aren't supports in place and you don't have enough supports, then you know, they really work with you, and they wouldn't put you into something like the paired exchange program until you and your family were in a place that was a good decision for you to make. So it's
Absolutely.
Ian does a very good job of making light of it, but it is something that is very serious and is taken very seriously on the donor side.
Absolutely. And the issue of, you know, the timing of the donation, et cetera, is also something that's taken into consideration. Michael, do you want to talk a little bit about that as well?
Yeah, absolutely. So there are lots of things that are going on in people's lives, and things change and work, and people have different work schedules. So, you know, especially somebody who comes forward as a non-directed donor like Ian did, you know, we're definitely like, we're not going to say, oh, you've done your workup, you know, it doesn't matter that your wife's sick, we're going to, you know, you have to go through this anyways. Those things absolutely matter. You know, we have donors that have very specific time frames for, you know, based on work, you know, those types of things, where they would want to be, you know, a donor in the summer or not a donor in the summertime, you know, that recover. And we can work around a lot of those issues. It becomes a little bit more difficult with the logistics of paired exchange, but we can work to timelines most often.
Thank you. The next question gets at the impact of COVID-19. Sarah, you briefly talked about that. So maybe I'll start with Michael first as an example of sort of the impact at a center level. And then perhaps, Sarah, you could talk about the general impact that you've seen across the country.
I think COVID-19 most definitely had an impact on not only KPD, but all of our transplant surgeries. So we did have a period of time where we were really only doing highly sensitized patients if an offer came forward. So we actually had some surgeries planned that had to be postponed and delayed till things opened up again. You know, if things continue with COVID-19 as they're going right now, you know, we don't have any plans to suspend activity again right now, but it is something that may happen if ICUs fill up, if people continue not to, you know, do the social isolation and things like that they're supposed to be doing right now. So it impacted all levels of things. It delayed things. We have people that, you know, unfortunately due to delays now have to repeat tests because they've gone on longer. So it's harder to get the test. So that's adding to delays. People have had to drop out of the program. So it's definitely had a huge impact on KPD and kidney transplantation in general.
And Sarah, is there anything that you would add from a national perspective?
Just to speak to what Michael said, and I covered it briefly in my slides, that when the KPD program came back on board after the pause in March, we've just asked programs and provinces to join when they are ready. And so typically we will do about 80 transplants a year, and we are at 30 right now. So there's definitely been a reduction across the country.
And one of the things that you touched on briefly, the ship kidneys, not donors, is a really, really important step forward.
It's a big push right now. Michael has been a great asset to the Canadian Blood Services team and the kidney pair donation team. Toronto General is at the forefront of shipping kidneys, and they have been there for a while. So we are just going to continue to move forward with that. It's safer, it saves cost for the donor and for their loved one. And so we are going to continue to do our best to ship kidneys in situations where it is the best possible situation instead of shipping the donors, and it protects the donors and the recipients.
And Ian, although this doesn't relate directly to the question, certainly relates to the last comment. You had to travel to Toronto. Was that, a factor in your decision and in the discussions that you had with your wife?
Well, yeah, I mean, my kids were, they were 8 and 12 or 8 and 11 when I made the donation. So we had a long conversation with them. That was obviously part of the process. So I think that if I had been able to donate in Winnipeg, which would have been my host transplant center, I think it would have made the process much simpler. It would have made it less disruptive. Absolutely. But I didn't have an issue with traveling to Toronto. And as it ended up, my wife got to spend 5 days in Toronto being a tourist, and I was in the hospital, so it worked out really well for her. So she probably would have preferred that we went to Toronto than do it in Winnipeg, because she doesn't really want to be a tourist in Winnipeg. So, but and there certainly were some assistance to cover the cost of travel, et cetera, and things have improved vastly since I made my donation. So, yeah, and I mean, I can't say good enough things about the folks in Toronto. I mean, I was treated really well. So yeah, it wasn't an issue for me. But yeah, I think if I could have made the donation in Winnipeg, it would have been a lot easier.
Mm-hmm. Thank you for those kind comments about the team. I know that they really appreciate it. And having grown up in Winnipeg, I know that there are many beautiful places in Winnipeg. So don't write in. I guess the next question is about the KPD program. It is a Canadian success story, but maybe Sarah, can you talk a little bit about the program and its place in the world, really?
So there is is the KPD program only available within Canada, or does it cross over with the US program? So it does not cross over with the US program, but there are programs in the United States. So it is the Canadian Blood Services Kidney Pair Donation Program is the Canadian version, or the Canadian program, but there are programs in other countries that are very similar.
And it's a very successful program relative to other programs as well. All right. Next question is, I guess, relates to whether hospitals can run their own paired exchange program. We've focused specifically on kidney here. So do you want to talk a little bit about that?
Sure. Paired exchange originally started with Toronto General and St. Michael's running their own programs, and there's nothing to say you can't do an internal exchange for some reason. It's something also looked at not only in kidney donation, but in more limited fashion with live donor liver donation as well. You can do exchange programs in those cases as well, although it's something that's not done a lot there. But the effectiveness of the paired exchange program comes from having involvement of all the transplant programs. When you limit it to just a local program, you're limiting, especially for the really hard to match cases. So your highly sensitized patients, it's just a much more effective program. So when we looked back at the first 4 years of paired exchange on a national level versus the first 4 years of paired exchange nationally, they had done a couple out in Ottawa, some out west. We had done 16 transplants over 4 years, and within the first 4 years of the KPD program, I think we had done 300 and something or something like that. So the night and day difference between doing something locally on your own and doing something on a national level, it is pretty well established. It is much more effective, and there's no advantage to doing things locally. Other than maybe in a little bit of timing issues in select circumstances, but for the most part, CBS and the job they've done with this program is absolutely amazing.
Mm-hmm. Agreed. The next question gets to the process. I know that we receive a lot of questions from patients who, are not quite clear as to whether they're on the wait list for transplant. Sometimes they may, there's some question around how you actually get on the list, and then how you get on how you become part of the National Paired Kidney Exchange Program. So maybe, Michael, can you talk a little bit about how this whole process works? When someone comes, is referred to our center, and then Sarah, potentially you could speak from your experience in another center and nationally, but maybe we could start locally. What actually happens when somebody is referred to a center? How do they know that they may be able to have a transplant, and then how does that discussion around being part of the National Paired Kidney Exchange Program actually work?
Yeah, so all recipients go through, the same evaluation, and as you go through that evaluation, you're informed of where you are and what your status is. So if you're ruled out at some point, you will get notified of that. But that happens fairly rarely. At the end of the evaluation, you're always presented to the transplant team here, and you will get written notification as well as a phone call that you have been cleared for transplant and you're put on the list. When you get that written notification, it'll indicate whether or not you're on the deceased donor waiting list or you have a living donor in evaluation. If you have a living donor in evaluation and we determine that they're not compatible for whatever reason, or there's a reason such as size or age that we would consider paired exchange, then obviously we go through the consent process of putting you into paired exchange. Now, somebody who's highly sensitized, they have a lot of antibodies, those people would probably be both on the Trillium Gift of Life or deceased donor waiting list, as well as paired exchange if they had a cleared donor. So you can be on both lists. You may only be active in one or the other. So if you might have a donor, but they haven't come forward yet, you've had a donor worked up and they weren't suitable and somebody else may come forward, we may make you active on the Trillium list at that point in time. And then when you have a clear donor, we can put you into the paired exchange program if that's indicated. So that's not one or the other. And every circumstance is different. And absolutely, you'll always have a coordinator. So whether or not you're in the evaluation stage, there'll be an identified coordinator that you can always call and talk to and ask questions about your status and what comes next. And then once you're on the waiting list, you're usually followed by myself if you're at Toronto General, or there'll be a coordinator that in most programs, you'll have an identified coordinator that you can contact.
Thanks, Michael. Sarah, is there anything that you would add?
No, Michael did a very good job of explaining that. That was fantastic.
Thank you. We've talked a little bit about the program and it existing in other jurisdictions. This person would like to understand the program in more detail. Hopefully this webinar served that purpose, but there's also a lot of information on the CBS website. Sarah, do you want to just remind everyone what the URL is, where folks can find more information?
Oh, Paula, you are putting me on the spot. Go on. I will get that URL if you want to pop to the next question, and I will have that ready for you.
Sure. And at the very general level, it's blood.ca, right? And if folks go to that website, they'll be able to navigate through to the Paired Kidney Exchange Program. Yes,
and there is a lot of fantastic information. So you are correct. It is www.blood.ca. And then at the top, if you navigate to Organs and Tissues for Life, across the top banner, it says blood, plasma, stem cells, and then Organs and Tissues for Life. You can navigate under living donation to the Kidney Paired Donation Program.
Fantastic. Thank you. The next question again deals with more of a broader policy issue. Apparently in Israel, organ donors or relatives get priority for transplants. Could your transplant program offer such a guarantee to individual donors who participate? So this is sort of very similar to an earlier question. Sarah, as part of the discussions around policy evolution for living donation, are models from other jurisdictions being considered? Is this particular policy initiative part of the discussion that you're having at the national level?
Paula, do you want to just reread that question? Sorry, I think you cut out when you were going through it.
Mm-hmm. So this is a question regarding a policy in Israel where anyone who signs up to be an organ donor or their relative gets priority for transplant. So essentially, it's an incentive to become a donor.
Okay, so at this time, I'm not aware of any discussions surrounding this policy in Israel, but that doesn't mean they're not happening. So from what I know, I am not aware of this, but as I just said, it doesn't mean that they're not happening.
Mm-hmm. And we know that in individual provinces, there's also organizations, organ donation organizations that do look at various ways to increase the deceased organ donation. So some of these policies may be on the radar of the various provincial organizations such as Trillium Gift of Life. Mm-hmm. Certainly the center hosts these webinars on a regular basis, and we are planning future webinars and hope to bring a webinar that would be focused more on exploring some innovative ways of increasing access to organs in the future. So stay tuned. I guess this.
Can I just add one thing to that, Paula? There are already existing policies on. So if somebody is an actual living donor, you would, and then needed a transplant in the future, you would get priority on the deceased donor waiting list, or even within the paired exchange program. So those things already exist. Just signing up as a potential donor, that incentivizing that is not part of the conversation right now.
Mm-hmm. Thank you. And we will cover this a little bit more next week as well, as we explore the wait lists, and hear from our provincial partners in living or in donation. So we addressed the next question earlier around notification. How do I know I'm on a donors list? Is this a question, Michael, that centers get a lot? Is there confusion around whether someone is on a list or not? Is there anything that they can?
From a donor perspective, no, because you would be going through the evaluation process. There's not really a donors list like there is a recipient waiting list. And once you're on paired exchange, they would have put you through the consent process to actually enter you in that. So you should always know that you're entered. What may be a little more confusing is if the recipient is on hold. You know, if it's a medical issue, we're not necessarily able to disclose that to the donor side of things. So you may be in the list, but may not necessarily be active. But the recipient should know about that. The donor should be able to ask the recipient, even if we're bound by privacy not to be able to discuss that.
Right. And if anyone has any questions around whether or not they're on the transplant list, or whether or not their donation is their organ donation assessment is proceeding, they can contact their living donor program or their transplant center to get more information directly.
Exactly.
Can a recipient enter the KPD with more than one donor? And are there benefits or reasons for this to happen? Sarah, this is probably a good question for you.
Yes. So yes, the recipient can enter the KPD program with more than one donor. And the benefits would just be to find the best match. So, Michael, I don't know if you have any real life examples.
Yeah, absolutely. So there may be reasons. So, you know, if you're a blood group O recipient, you have an A donor and a B donor, that again, increases your ability. So if you're not finding one donor that matched, the other might match a recipient, so that increases it. Or if somebody is highly sensitized, having multiple donors, again, increases the chance that you might be exposed to a match, because both you and your donor have to match. So if we're having difficulty matching one particular donor, another one may. So those are usually the reasons that we would do that. Generally, we would, enter you with one donor first, and then, if we haven't found a match, then, we'd work up a second donor. I don't know if we generally stop at 2. There's not usually a lot of statistical advantage to having more than 2. But I think, Sarah, correct me if I'm wrong, I think you can have up to 4, or is that not a policy?
Ooh, off the top of my head, I don't think I can answer that question. Let me do some digging and get back to you. All
right. But yes, the simple answer is yes, you can have more than one donor, but we don't work up more than one donor at a time here at Toronto.
Okay, and off the top of the team's head, they're not aware of a limit.
Okay, there you go.
All right, and I think we're coming to the end of this session. We'll just take this final question just with respect to mixing of adults and children. Sarah, does the KPD program mix adults and children in the matching process, or are those 2 separate processes?
So we are looking for the best possible match. And so I know Michael previously discussed size mismatch. So adults and children, it's more looking for we want the size of the kidney. So we want to make sure, short answer, yes, we do mix them. Michael, do you want to speak more at a program level?
Sure. One of the big reasons, you might go into this is this is where an age difference would come in, and we'd be a little more selective on the age of the donor that the child receives. So if you had a 65-year-old grandparent and a 12-year-old child, that would be somebody you would want a better age match for. All right. So it definitely is. There is here, sick kids would work up the recipient. They would put the recipient in. The donor program here would work up the donor and enter them into the program.
Great, thank you. There are a few more questions, but I think we may be able to address those questions at next week's webinar, where we're talking in a bit more detail about the kidney waitlist and other factors related to kidney living donation. So I just wanted to thank everyone for joining us today. This is the details for the upcoming events. So next week, our webinar will focus on referral assessment and the wait list. And again, we'll feature a similar format as this one, with a lot of time for questions. And our final webinar of the year will look at the role of physical activity for living donors and transplant recipients. We've got 2 excellent speakers, and you can register online at givelifeuhn.eventbrite.ca. All of these sessions, as usual, are recorded and available on our YouTube channel. So on behalf of the center, I'd like to thank our great speakers. Thank you very much for taking the time to share your expertise. Ian, thank you so much for taking the time to share your story. It's really, really important that we hear from living donors and from recipients and from caregivers, all of whom have a stake in this. So please join us next week. Visit the Center for Living Organ Donation's website if you'd like more information, or visit blood.ca for more information on the Kidney Paired Donation Exchange Program. Thank you for joining us. We'll see you next week.